Has your doctor ever told you that arthrosis is a sign of aging and that you can't do anything about it? Then I'll let you in on a secret. Our body consists of 0.2% sulfur. I'm sure you've never heard that before. After all, sulfur is toxic, right? That's what I've had physician colleagues tell me. This sulfur is important for our joints. You have more sulfur in your body than iron or magnesium, considering the total weight. Without sulfur, there are no healthy joints. That is simply a fact. And if we want to fight arthrosis, we need enough sulfur so that the cartilages in the joints remain healthy. Let me draw a knee joint. There we go. Outside of the joint is a capsule. And inside the joint, we have a joint fluid. This fluid needs a lot of sulfur. And now to the surface, the bone here. This thin surface on the bone inside the joint consists of cartilage. You know cartilage from meat, this hard stuff that you can't really eat. This cartilage has a very smooth surface, and when this surface remains smooth, you have a healthy joint. As we grow older or we have a deficiency of sulfur, then this cartilage decreases. So the thickness of the cartilage becomes thinner, and the surface in the joint becomes somewhat rough. This process is called arthrosis, and it is important to know that you can stop this process with sulfur-containing organic compounds. It is even possible, I have seen this in many patients, to rebuild this cartilage layer in the joint. It takes 3 active ingredients to do this. MSM, Methyl Sulfonyl Methane, that is the full name. Then you need chondroitin sulfate. This is also a sulfur-containing compound. Your doctor knows this connection. In Switzerland, there is a product called Chondroitin, which is prescribed to almost all arthrosis patients. But it doesn't really help because there is only one substance in there. But we need all 3. We need MSM, chondroitin sulfate, and glucosamine. Only a product that contains all 3 substances, and this is seen in studies, has good success. The individual substances, they might help 10 to 15%. But in combination, we have great effectiveness. I have several patients whom I could spare an operation that was already scheduled. If you want to know more, below you will find a link with more details. The studies on this topic are listed there, and you can get more information. When you find a product with all 3 active ingredients in it, you need 3 capsules per day for 1 treatment. With every meal, take 1 capsule in the morning, 1 at noon, and 1 in the evening. And then you'll need a lot of patience. It takes at least a year, sometimes 2 years, until these cartilage layers are somewhat rebuilt. When the cartilage layer is already completely destroyed and the bone rubs on bone, then the only option is surgery. You will need an artificial joint. But as long as there is still cartilage there, you have a chance to rebuild it. If you suffer from knee or hip pain, or pain in any other joint, then I recommend this triple combination for a longer period of time, and please be patient. It doesn't get better after 3 weeks. My experience is that you should take this combination for 4 to 6 months, until the pain relieves itself somewhat. It takes patience, but it is still better than surgery.